Our next speaker is Dr. Andrea Wolf. She's director of the New York Mesothelioma program at the Icahn School of Medicine at Mount Sinai, where she's also an associate professor of thoracic surgery. She has a very unusual background. She has training at the premier institutions in thoracic or chest surgery at Brigham and Women's in Boston at Mass General. In addition, she did a research fellowship to study oncology, particularly chest cancers, and she has a master's in public health. So she's one of the few public health thoracic surgeons that you may run across. But her main thing, I think, is operating on people with mesothelioma and lung cancer. She heads the team at Sinai, New York Mesothelioma program, and they've recently won the award from the International Association for the Study of Lung Cancer, the team award for their work. So welcome, Andrea.
Thank you, Dr. Markowitz. Thank you, Linda. And thank you to my fellow panelists, the audience, and the Asbestos Disease Awareness Organization. I'm going to share my screen. I have no relevant financial disclosures, but I should disclose that as the center where Selikoff discovered the relationship between asbestos and mesothelioma, we see a lot of mesothelioma patients. And as a surgeon, I've spent decades operating on mesothelioma patients. But the truth is, the most important parts of treating these patients, I've learned from a unique capacity. To set the context, it's easiest for me to start here. This is March of 2020. And this is the view from the pediatric ICU at Sinai. That tent across the street on Fifth Avenue is the hospital that they built outside of the hospital to accommodate the burgeoning COVID population. At the time, there were 750 COVID patients, or 88% of the hospital was COVID. That view, though, wasn't from a patient's ICU room. That was actually from my son's room. My son, Georgie, he has a chronic medical condition that he's had for 15 years, and that's what led us to that room. Fortunately, he's improved since the surgery that you see him recovering from here. But for 15 years, we've required very specialized medical care. And he requires care for his disease, but the actual treatment and support, they're for Georgie, who's a person, and for me. And so I admit that 99% of what I have learned about taking care of patients as a surgeon and as a doctor has really occurred through experience as a caregiver of someone with a chronic medical condition. And not surprisingly, the concept for my mesothelioma program is modeled after the multidisciplinary program that has cared for us for 15 years. So at Sinai, I've created the New York Mesothelioma program. We're currently expanding it to include other asbestos-related diseases through collaboration with Sinai's Selikoff Center for Occupational Health and the Division of Pulmonology. Our website has been recently revised, and the updated version goes live this week. We see patients as a multidisciplinary team. I'm the surgeon. Jorge Gomez is the medical oncologist, and we've recently added Christian Rolfo to this group. Ken Rosenzweig, who essentially invented adjuvant radiation after pleurectomy decortication, he's our radiation oncologist. We have oncogeneralists who specialize in internal medicine for cancer patients, palliative care doctors, social workers, and psychiatrists. Patients are offered opportunity to enroll in clinical trials. In fact, we take the role of offering cutting-edge clinical trials very seriously. We're currently accruing patients to a trial evaluating the benefit of this synthetic vaccine called PolyICLC in patients with mesothelioma who are candidates for surgery. Eligible patients undergo biopsy and injection with the vaccine in the same setting, followed 3 weeks later by surgery. We are a quarter of the way into study accrual and have found that the treatment is very well tolerated and is quite safe. We're currently analyzing the data and following for long-term results to determine the potential benefits in delaying progression and recurrence of mesothelioma and prolonging survival for patients with this disease. Coming back to the premise for my program, it is in treating the patient, not the disease. In fact, here is the disease. This is meso. It's ugly, like really ugly. That picture at the bottom is as good as it gets after the disease has been removed. And that's what's in the huge bucket in the upper right-hand corner of your screen. But we're not treating the disease. We're treating patients. And patients come to us with very personal stories, as you've heard in the last day and this morning. These stories, while so individual, are all too common. Patients come to us with frightening symptoms, with or without diagnoses, and have often been given grim prognoses by people who don't understand the disease well. They're scared, and their caregivers are scared. But our job as surgeons, physicians, scientists, advocates, as human beings, is to take care of mesothelioma patients and their caregivers. And so programs like ours aim to provide comprehensive team-based care to care for these patients and their caregivers, to help our patients and their caregivers live to fight another day. So thank you for listening, and a special thank you to the boy who has taught me everything I know about taking care of patients and families.
Thank you, Andrea, in many respects for that talk.